You can see Claire is rather persuasive. Personally, I couldn't agree more with that video. In fact, I could hardly have said it better myself. It's now my great privilege and pleasure to call upon our interim Home Secretary, Dr. Hal Fallon, who is a clinical professor of medicine at the Medical University of South Carolina, to introduce this year's member awardees. Hal? Welcome.
Thank you, Harvey. It's a pleasure to be back in some ways, but a very difficult situation in another because of my very good friend, Steve Ryan. One of the responsibilities of the Home Secretary is to be chair of the Awards Committee. The Awards Committee is somewhat of a thankless job, but they reach conclusions every year based on a number of nominations made by members as well as by staff. We thought, or I thought this year, that perhaps there was a situation looking at these nominations that so many owe so much to so many. The award this year, the three will be made. The first is the Walsh-McDermott Award. Walsh-McDermott is given credit as the primary founder of the Institute of Medicine in 1963. The award is given in his name for an individual who has contributed over a significant period of time to both the IOM and the NAS. This year, the awardee is Don Berwick. Don is a former president of the Institute of Healthcare Improvement, former administrator of the Center for Medicare and Medicaid. He's served on the IOM Council, and he's done numerous other things. But Berwick's contributions to the IOM have come clearly in the area of healthcare quality. He was a critical member of the study committees on the quality of healthcare in America and the seminal study To Err is Human. Crossing the Quality Chasm and a series of other studies followed on this area and have had great impact on health policy as well as practice. He was a key innovator in the national effort to improve health quality, both in serving in the private sector and in government. And it's been based exclusively on scientific evidence. Don has continued activities within the IOM and the Academies in various public positions. He remains in the public arena, as those of you who live in Massachusetts must know. Don, would you please come forward? The second award is the Adam Yarmolinsky Award. As Harvey mentioned a few minutes ago, Adam Yarmolinsky was also directly involved in the initiation of the Institute of Medicine, but he was not a clinical or basic science professional. This year, the recipient, which is given only to a member from a discipline other than the clinical and health sciences. The award this year is given to Alta Shara, J.D., who is Warren P. Knowles Professor of Law and Bioethics in the School of Law and in the Department of Medical History and Bioethics of the School of Medicine and the School of Public Health at the University of Wisconsin. I think Alta may deserve an award for reporting to 3 different deans. I find that amazing. She has served on numerous committees of the IOM and the NAS, contributing her expertise in both law and ethics. She has a vast knowledge of federal policy and the various federal agencies, and this skill brings a great deal of information to study committees which she has served on. She has been a chair of the Subcommittee on Assessment of Health Outcomes related to childhood immunizations. She's participated in the future of drug safety, and this study has led to changes in FDA regulations. Her contributions on issues such as trust, patient autonomy, literacy, and parental concerns have been critically important. She's been highly regarded by our colleagues for wisdom, knowledge, and wit. Alta, would you please come forward? The David Rahl Award is given in the name of David Rahl, who was the first Foreign Secretary of the Institute, and also he was the first director of the NIEHS. It is given to someone who has distinguished service to study committee or committees. The recipient this year is Ellen Wright Clayton, who is Craig Weaver Professor of Pediatrics and Law at Vanderbilt University. Ellen is currently the chair of the Board on Population Health and Public Health Policy and also serves on the IOM Council. She has chaired 2 committees on family planning in the background of a lot of political and public interest in issues that relate to contraception. She has also chaired the committee to review the adverse effects of vaccines, another public and oftentimes controversial topic. She helped produce the definitive study on the topic of adverse effects of vaccines, and this was an enormous effort. Excuse me, there is hay fever in October in Washington. Now Ellen co-chairs the Committee on Commercial Exploitation and Sexual Trafficking of Minors, a very important and critical study. Her extraordinary leadership and wisdom in these committees justifies the award given in David Rahl's name. Ellen, would you please come forward?
Thank you very, very much, Al. It's now my pleasure to invite Clyde Behney, the interim Leonard D. Schaefer Executive Officer here at the Institute of Medicine, to present this year's Cecil Staff Awards. Clyde?
Good morning. Each October at this meeting, we honor 3 IOM staff members with the Cecil Award, named for the snake-like symbol or logo of the IOM. It recognizes staff for sustained outstanding contributions. It's accompanied by a medal, and staff appreciated is also accompanied by $5,000. The first awardee, Pamela Atayi, Administrative Assistant to the Board on Children, Youth, and Families, is receiving the Sandra H. Matthews Award. Pamela has supported the board since 2009. In her central position, she serves as an invaluable resource to both new and seasoned board staff. Going above and beyond the job description, Pamela single-handedly designed the board's website. She also helped design a set of communications products that capture the full spectrum of the board's work. In all of the tasks she tackles, Pamela exhibits deep knowledge of the institution, the mission of the board, and the messages it aims to put forward. Pamela? I think you're going to come over here. Abby Mitchell, Senior Program Officer with the Board on the Health of Select Populations, is receiving the Research Cecil Award. In her 11 years at the IOM, preceded by 5 at the National Research Council, Abby has steered many high-profile studies to successful completion. Her work has met the highest standards of scientific rigor and scholarship. As a result, the studies have held up under the test of time and have had significant impact. She has demonstrated remarkable versatility directing studies in many different areas, from veterans' health to infectious diseases to medical devices, and there's a longer list than that. Abby's work consistently stands out as a benchmark in all these areas, and I would add that whenever a new project comes up, people ask, is Abby available? So, Abby? Catherine Bothner, Associate Program Officer in the Executive Office, is receiving the Wild Card Cecil Award. Catherine joined the IOM in 2006 and has played a vital role on prominent studies and major workshops. She brings her varied experience to her current position, where she serves as a mentor to staff and a guider to staff on procedures related to the IOM programs. She has revamped the staff intranet, which we call Cecil Says, established an impact tracking system, launched a staff blog, and put a number of other mechanisms in place to facilitate staff collaboration and enhance training. She organizes our emerging set of procedures for roundtables. We have now have 19 of them. She has set up what we call Cecil University, which I wanted to note because it's an amazing concept. Innovation is a hallmark of Catherine's work, and she always succeeds. She always does something that has considerable impact on improving the way we work at IOM. Catherine?
Thank you very much, Clyde. Join me again, please, in congratulating our 3-member and 3 staff awardees. Fantastic. I'd now like to also express our appreciation to the committee who planned our program for this year's annual meeting. First is Nancy Adler, who's a professor of medical psychology in the Departments of Psychiatry and Pediatrics and director of the Center for Health and Community at the University of California, San Francisco. Second, Stephen E. Hyman, Harvard Distinguished Service Professor of Stem Cell and Regenerative Biology at the Broad Institute. Third, Arthur L. Kellerman, Dean at the School of Medicine, Uniformed Services University of the Health Sciences. Fourth, Judy A. Salerno, our former Leonard D. Schaefer Executive Officer here at the Institute of Medicine and currently the CEO of Susan G. Komen for the Cure. And finally, Lauren G. Schern, our Associate Program Officer at the Institute of Medicine. Please join me in thanking the committee who helped assemble such a wonderful program. And now it's my special pleasure to welcome and introduce Dr. Nancy Adler, who will in turn introduce today's program. Nancy, the floor is yours.